Hey everyone, Julien here, nurse practitioner for Danesthetics Medical. Our clinic is located here in Ottawa, and today we're doing an Instagram Live with the one and only Dr. Hani Sinno. Dr. Hani Sinno is a board-certified plastic surgeon in Montreal. He's known to do deep plane facelifts, neck lifts, actual rhinoplasties, and also breast lifts. And he's quite renowned. He's actually just been voted top 3 plastic surgeons in the region. And I think his new practice has been up and running since 2017, but he's a graduate from DeGrill with also a fellowship from Harvard. So I'm looking forward to talking to him and introducing him to you, because a lot of my clients come and ask me questions such as, when is the right time for plastic surgery? If I want to do a facelift, should I start in my 40s, 50s, or 60s? Is there a time that's too early, too late? How young is too young for a rhinoplasty? And all these questions, we're going to be answering them right now. And what I really like about Dr. Hani is that he also does injectables, so non-surgical options as well. So sometimes you get a biased opinion whenever you're talking to another provider who only does one thing, only plastic surgery, or someone who only does injectables. He does both. So we're going to get a nice, honest opinion here. I'm excited to introduce him. You guys, if you have any questions, ask away. Let's bring him on. Hey YouTube, before we jump into the video, make sure you check out my Patreon account. It's designed for serious medical aesthetics providers just like you. How's it going, Dr. Sinno?
Good, thank you. Thank you very much for having me. I truly appreciate it.
My pleasure. So I did a nice little introduction for you, but I'll just recap a little bit. So Dr. Hani Sinno, board-certified plastic surgeon from Montreal, and his clinic is based there. He's graduated from McGill. He's also done a fellowship in Harvard. And I think your new practice where you guys are located now has been up and running since 2017?
That's it, correct.
Nice. And you also do injectables, you do non-surgical options, but you also do plastic surgery too?
Absolutely.
Terrific. Welcome, man. Welcome.
Thank you. I want to congratulate you, Dan, for an amazing job you've been doing, and for your followers, how much knowledge you're bringing them. So that's kudos to you.
I appreciate that. So let's get right into it, man. I'm going to ask you some questions that I get asked all the time, and it's great that we have a board-certified plastic surgeon who can answer these questions. So right off the bat, let's cover your top plastic surgeries that you do. So let's recap what your favorites are.
So the way I got my name in the country was breast surgery. So when I went to Harvard, I learned how to do face and neck lift surgeries and rhinoplasties. When I came back, I did tons of breast cancer reconstruction. So I was hired here at one of the biggest hospitals in Montreal, the Jewish General Hospital. And because it's just the patient population, they had a lot of cancer, BRCA gene. And also I was at Cité La Santé Hospital. Again, we have the founder effect, so there's a lot of cancers within the French Canadian population, unfortunately, in breast cancer. So I had tons of experience. We're talking about tens of thousands of patients, and that's basically my bread and butter. So breast surgery is definitely the most common procedure I do. I do love doing rhinoplasties. I think it's quite challenging. It's life-changing for patients, and facelift surgery. So those are the top 3 that I do the most.
Okay, excellent. And so you're doing facelift and neck lift?
Yes.
What's the difference between like a regular facelift or a deep plane facelift, or all the, you hear these, different types of facelifts. So explain if you can.
Well, honestly, it's a fantastic question. In the 90s, deep plane facelift is not a new concept. It's just new now on social media, and everyone's talking about it. In the 90s, it was developed by a chap called Sam Hamra, and he popularized it. And basically what it is going in. So in a typical face and neck lift, what we do is we lift the skin and we go work on the layer that's under the skin that you know very well as an injector, called the SMAS, the superficial myoaponeurotic system, which is in connection with your platysma. So this muscle here that's around the neck, I'm going to make a funny face, excuse me for all your followers, but you're going to see it exactly. This muscle here is called the platysma, and it's attached to all the muscle layer which we've lost with years of evolution, and it's called the SMAS. Now that layer, we lift it up, and that's the typical face and neck lift, and we attach the muscle in the middle, and we lift the muscle in the back. The deep plane face and neck lift that was established in the 90s went under the SMAS. So we lift the skin, we lift the SMAS, and we pull the SMAS. Because a typical face and neck lift, what it lacks is mid-face volumization and lifting, because of all the facial ligaments. So you don't go through them. With a deep plane face and neck lift, you cut all those ligaments. And so this way you're going to be able to really pull the face neck backwards. Now the problem with deep face neck lifts is that you're lifting this mass off the facial nerve. And as you know, there's 5 branches of the facial nerve, and that's the nerve that is responsible for the motor movement of our face.
Yeah.
So all the muscles of facial expression that we sometimes target with neuromodulators to relax our muscles because of the frowning effects, for instance, or the crow's feet. If we cut the nerves, they're permanently paralyzed. But if you do that in areas where you don't want to do that, like the lips, you're going to get paralysis for life. So that's one of the major disadvantages of a deep plane facelift is that you increase the chance of nerve damage. So they did studies on this in the 90s. So in fact, in the 90s, the ethics was a little bit different than the ethics now. So what they did was there's 2 landmark studies. Half the face was done by one surgeon, half the face was done by another surgeon, which is kind of unethical now to do that. And then another study did a twin studies. So one twin got one type of facelift and the other twin got another type of facelift. So in both these studies, what they saw was that the outcome, the results at 1 year, 5 years, and 10 years, so it's a very long-term study, were not different between the sides of the face and were not different between the twins. However, what was different was the amount of swelling. In the deep plane face and neck lift, there was tremendous more swelling. So most people abandoned the deep plane facelift in the 90s, the 2000s, and only in the past 2-3 years did this come back. Now, the ear, nose, and throat doctors, not plastic surgeons, are the ones that have popularized this again. I'm not sure if they read the plastic surgery literature or not, but that was the plastic surgery literature. There's no more debate. Let's just do the regular mastectomy or SMAS lift, which is what I went to train at Harvard. So the first 12 years of my practice, that's what I did, and patients were extremely happy. Now, with social media and the deep plane facelift, and everyone's asking for it, I went and trained with one of the major names in the deep plane, Dr. Nayak in St. Louis, an amazing human being, very generous man. He allowed me to go and shadow him. There's a few key doctors that do this, and I loved it. Like, the results that he gets are spectacular. They're much more definition that you can get, especially in the jawline and the neck with a deep plane. And so I learned those techniques and I brought it back to here in Montreal, and it's been many months now that I've been doing this, and I love it. But there is more swelling that we do see, and there's a little bit more risk to that facial nerve. So you have to go to someone who's trained well and has a lot of experience and a good surgeon.
Nice. Oh man, that's amazing. Actually, I had no idea about all that. So terrific. The other question too is some people, they'll come in and they'll say, listen, I've got a little bit like more sagging skin in the neck, but I'm not sure if I need a full facelift. So how can someone know if they're due for, let's say, just a neck lift, or if they need the full face and neck? And does a face also cover the neck?
Yeah, so it's a question that I get a lot from my patients too. So I congratulate you for asking this question, Dan. So I think a lot of people would benefit from this. I have done just neck lifts, but usually I try to encourage the patients, since we're there, might as well lift the face and the neck. The added benefit of doing the face, besides just the neck, if someone only wants the neck, for instance, is that it improves tremendously the jawline if you lift the face. If you only lift the neck, you fix that kind of the turkey neck and the lack of the jawline, so you're able to help them a lot. But just because the incisions of the neck lift go just in front of the ear lobule and behind the ear and the hairline. If you just extend the incision by 2 centimeters, which is not that much, you can do a facelift. So most of the time, it's an economical issue. That these surgeries can cost a lot of money. Just to let you know, the place where I went to train, just the neck lift, which is around an hour and a half surgery, is 90,000 American dollars. You add the face, you're adding a little bit more. Obviously, in Canada, our prices are much different. That's why I have a lot of patients that come to me from New York and Vermont and Ontario, because we have good surgeons here in Montreal, but we're also much cheaper. But there's some surgeons in the world that charge $400,000 for a face and neck lift. Wow. So it can be an issue of price, but most of the time I try to tell patients to go for the facelift as well. But we could definitely just do the neck if that's all that's needed. Terrific.
Now the next question that's all related to that is going to be age. So a lot of people are coming and asking me, they're like, am I too old for a facelift? Am I too young for a facelift? Like, what's the age? I think I used to remember people only doing this stuff in their 50s and 60s, but I kind of see like celebrities doing it now in their 40s. Yes. Where's the age now? Is there an age where you say you're too young? Is there an age where you say you're too old? And where's the secret space?
So the youngest patient that I've done a mini facelift was in her 30s. And the oldest patient that I've ever done was actually when I was at Harvard, was an 85-year-old. So it wasn't my patient. My oldest patient was 75. So to me, the age is just a number. It's about the deformity that's present. So in my 30-year-old patient, she really had a lot of deflation. She lost a lot of weight, and her face did fall faster than it should have. So we did a mini facelift. So it's a small, tiny incision. We were able to lift it with no neck involvement. And the older patient clientele, you just need to make sure that they're safe. And all clients or patients. So if the older the patient, you just have to kind of understand their anatomy, has changed, but more importantly is their physiology. Can they handle a procedure? Now, the good news about the face and neck lift is you don't have to always do it under general anesthesia. You can do it with local, purely, or you can just add a little bit of sedation, which can help the older patients if they're not candidates for general anesthetic. But just to answer your question besides that, Dan, is because people like you are injecting patients and they're pushing the age for a little bit older now, so you don't need the facelift because you're able to do so much more early on, and they could kind of postpone their face and neck lift.
So you're saying kind of like 40s to late 60s is probably like the average, but there's no real set number, but
Yep.
Those are definitely like the parameters right now that are probably the average.
The average population of face and neck lift in my practice is about 55. And now I've done, like I shared with you, I've done 30s, 40s, 50s, but it depends on the patient. But the average, we're talking about above 55.
Okay, very cool. Now we're talking about injectables here. With injectables, sometimes you hear mixed reviews about plastic surgeons with regards to biostimulators. Definitely, hyaluronic acid is a different thing. Yes, people can be over-injected if using appropriately, minute amounts, specific requirements to make sure it looks natural, great. But the big one a lot of people are not sure about are biostimulators with regards to facelift afterwards, because sometimes we'll hear things such as Sculptra you can't do, Radius you can't do, because what it's doing is eliciting scar tissue. When it comes to doing any facelifts afterwards, it's going to be much more difficult. They're going to have to subsize all that, and you're not going to have a great result if you've done that in the past. How much truth is that? Do you like biostimulators, and do you have a preference? Do you believe that there's one that's better than the other?
Biostimulators are, I humbly believe, because of the results that I've seen, are fantastic tools that we can offer to certain patients, to the right patient. As you shared, they're just a filler with an injection. You inject it in the proper plane, the subcutaneous plane, and it stimulates the body to form collagen within 6 weeks, and that collagen has a contraction and lifting effect that should last you around 2 to 3 years. So it's a reality that I see in my patients. It also improves the skin quality. So there's multiple added benefits to biostimulators. But the reality is they do form scar formation, and I have seen that scar formation. In fact, as an injector, I'm sure you felt it. If you've done a biostimulator injection, and within the 2-3 years you did another injection, a cannula won't be able to go through or slide as easily as it would have been if you had done an HA, hyaluronic acid filler. So 100% there is scar formation. That's what it's supposed to do. Now, when it comes for a face and neck lift, I have no problems with doing a face and neck lift with a patient who had the biostimulator. We're used to working with different types of situations. For instance, a male patient can have more bleeding, a little bit more difficult to do in the face. And the reason why males have more bleeding in the face is we've got beards. And so we have more vascularity. Each hair has its own vessel. So we are used to doing these procedures in a little bit more difficult situations. You just have to know about it. And even if you see it, it doesn't increase the risk or complications, in my humble opinion. What biostimulator do I prefer? I like using Radius to sculpt the jawline, especially for men. And I like Sculptra to fill and volumize, for instance, the cheeks in the feminine population. So that's my preference. I just feel like Sculptra does a little bit more softer fill. Radius gives a little bit more chiseled type of result.
Great. Thank you so much. Dr. Sinno, I hope to see you shortly. I'm in Montreal kind of often enough. I probably go every couple months. So if I'm ever in the region, I'll stop by, pop in your clinic and say hi.
You're always welcome, Dan. Thank you very much.
Thank you so much. All right. Take care, everyone.